Welcome to my friend and fellow Regent, Dr. Henri Ford. Dr. Ford is the Dean and Chief Academic Officer at the Miller School of Medicine, the University of Miami, and also the Program Chair for the American College of Surgeons Annual Clinical Congress. Welcome, Dr. Ford.
Thank you very much. It's a pleasure to be here.
Well, it's a pleasure having you here, and I've marveled in awe every year at the magnitude of work that you and your team do, putting together the superlative, world-renowned, and seemingly improving year after year annual clinical congress. Could you start by letting us know what goes into creating a typical in-person annual clinical congress that attracts almost 10,000 people?
Thank you so very much, Steve, for this question. Making the program, the Clinical Congress, is trying to either make your favorite soup or gumbo or sausage, whatever it is that you prefer. And then I always start like that when we convene to actually select the abstracts. But way before that retreat that usually takes place in July, and we start with the call for abstracts. And there's a call for panel sessions, for videos, and surgical forum papers. And there is a process for surgical forum. Committee reviews all of these particular submissions. We have the program committee that's responsible for looking at all of the panel sessions, the meet the expert sessions, the town halls, the didactic courses that we offer, the surgical skills courses that we offer, and also to oversee a number of all of the named lectures. So that all of that falls within the purview of the program committee. The membership is informed as to the deadline, and we try to encourage people to submit the abstracts by usually May 1st, although in this particular year, we extended the deadline because of the global pandemic until June. This gives us sufficient time to go through the review process. Again, the surgical forum is done completely independently. That's chaired by Dr. Edith Zhang. Once we receive the abstracts that have been submitted for all of these other entities that we talked about, whether it's a panel session, meet the expert, town halls, didactic courses, and so forth. Then there's a systematic review that takes place. We have different individuals who focus, say, on meet the expert, people who focus on review of the surgical skills courses and didactic courses and town halls. And then the program committee itself tends to concentrate predominantly on the review of all the panel sessions. And that usually approaches almost 400 submissions. And out of that, typically we will take no more than about 110 to 120 panel sessions. So there's a whole lot of work that goes into selecting the very best abstracts, the very best submissions to present to our fellows. And we have to make sure that it's balanced, it meets all of the needs, educational needs of a diverse group of fellows and specialty fellows as well. And not to forget our international fellows. So those are the types of considerations that the program committee brings to the table every time we convene. So each abstract is reviewed. For this year, we had 3 reviewers, 3 members of the program committee reviewed each abstract independently. It's an electronic review process, and they are graded. Then we look at the overall grades that they received, and then on the basis of the total score, we select the abstracts in each category that should be considered, that should be reviewed. Because of the preliminary review that's taken place, so we are able to more or less eliminate a lot of the low-scoring abstracts because either they were poorly written or they had some major flaws to them. And so we spend then the rest of our time during our retreat focusing on the very best abstracts that are worthy of consideration and making sure that we have balance. By the end of our 24, 36 hours of deliberation, we have come up with pretty much a preliminary program that we try to make sure is well balanced, meets all of the different requirements of our fellows, and will be well received. Remember, we have submissions from all of the various advisory councils. We try to make sure that there is some representation for each advisory council, so that every member or every advisory council feels that they have contributed to the creation of that sausage or soup that we talk about. And the final program is normally approved at the annual meeting of the Clinical Congress. At the Clinical Congress, usually we convene the Saturday before the start of the Congress, and everyone reviews the submissions that have been accepted by the program committee, and then all of the representatives of the various advisory councils end up voting the program. So that's basically how the program is convened, but that's typically about 90%, because invariably we will have some late breaking abstracts that are going to come. So we usually leave a few spots for the late breaking abstracts or very important panel discussion that may come up at the very, very last minute. So we have enough flexibility, we leave enough flexibility in the program to accommodate those types of last minute modifications, because we want the Clinical Congress to be quite relevant and also timely. By selecting the program a year in advance, and if we don't leave any flexibility, then we will not be able to capture some of the latest occurrences that may have occurred, some of the latest events that may have occurred, and that could be important for the fellows to benefit from. So that's why we have to build in some flexibility in the process.
Thank you very much for explaining the workings of the program committee and the creation of the annual clinical congress. Given the timeline you just mentioned, one would surmise that the October 2020 program would have been planned or more or less finalized, 90% of it, as you say, during the October 2019 annual clinical congress. And then along came March and COVID, and we had our peaks in New York, and you and I have just recently experienced our peaks here in South Florida. And somewhere in the midst of all that, a decision was made to convert, as have virtually every meeting, no pun intended, to a virtual meeting. And many of these other meetings involve a handful of people to perhaps a few hundred people. And here we're sitting with thousands upon thousands of people. How was that transformation achieved to get from the plans of October 2019 for an in-person meeting to the current plans of a virtual meeting?
Well, Steve, what can I tell you? It's been a real challenge, but let me say that the education staff at the college, the leadership of the college, and members of the program committee have risen to the challenge. We've been tested. And not only did we have to reimagine what the Clinical Congress 2020 was going to be, after having selected all the abstracts back, for the most part, back in October of last year, we also had to start planning concurrently for Clinical Congress 2021. So you imagine, if we talk about double jeopardy, that's really where we've been. But what we did as a group was to start convening as frequently, and going back to the month of March, when the pandemic really struck. We recognized that we couldn't continue to just do business as usual. Normally, the program committee meets at least typically once a month. we started meeting literally almost every 2 weeks to see exactly what we're going to do. At the time, we weren't sure whether or not we were going to be able to offer a virtual or in-person Congress, but we were preparing ourselves for various contingencies. And by the time we hit early May, it became abundantly clear that we needed to be ready for a completely virtual meeting. And so the program committee went to work, and I appointed a small task force, or small group of members who took the program apart and began to select out of the 120 or so panel discussions that we'd already selected, so which ones should be offered live. So within, say, the context of a 3-day or 5-day meeting, and which ones could be offered potentially asynchronously, so that the membership would be able to benefit from the content from the offering, but it wouldn't necessarily happen at the same time, because we didn't know what kind of constraints we were going to face. And we reimagined the entire Clinical Congress. We started to, as our guiding principle, we said we would maintain all of the named lectures, and we would use them to anchor subsequent panel discussions that would take place throughout the day. We also recognized that our fellows were not going to remain glued to the computer for an inordinate amount of time. So we, as a guiding principle, Dr. Ajit Sachdeeva, who heads the education department of the ACS, made the suggestion that the program committee completely embraced, that we should limit it to about 6 hours of educational offering on a daily basis, split in 2 3-hour blocks. And based on that, we were able to determine the number of panels that we could offer. And we also came to the conclusion that we would have to eliminate some of the attractive components of the Congress, mostly because the Zoom format, whatever platform that we were going to use, would not be able to support them. So surgical skills course, obviously we couldn't offer. The didactic courses and to a large extent the town halls just would not lend themselves to be as attractive in the virtual clinical congress. So we had to more or less eliminate these offerings. And initially we thought that it would also be a bit of a challenge to offer the surgical forum in that tight time zone, but time frame. But we have since re-examined this particular plan, and now we are contemplating hopefully offering the surgical forum the Saturday and Sunday before the official typical start, which normally is from Monday to Wednesday. So we are hopefully going to finalize that particular aspect fairly soon. And by doing so, it will allow us to be able to present to our fellows nationally and internationally virtually 90 to 95% of the content of the Clinical Congress as originally imagined in October of 2019.
Thank you. And that brings me to one more point. With all of these activities in rapid flux and the timetable nearing, there are many people who are going to have to get their contributions done for the meeting to ensure that the content is delivered. And if the Quality and Safety Conference is any predicate template, I expect far more people around the world than would normally fly to the US for an annual clinical congress. So what can we as fellows do to help you? You've done the Herculean undertaking, but what can we now do to help lighten your burden?
Well, thank you so much. And that's such a timely question. The education department, the program committee, we are fully committed to make sure that our fellows can benefit from all of the multitude of offerings to enhance their educational pursuits. We know that so many people depend on the Clinical Congress to update their knowledge, understanding, and normally their skills. Recognizing that we can't probably deal with the skills part, but we want to make sure that you have access to the latest state-of-the-art information to improve surgical outcomes for your patients. We desperately need our presenters to upload their information in a timely manner. So we will need everyone to get their presentations uploaded correctly in the correct platform, and all those instructions are being disseminated to the presenters. They will need to be uploaded no later than Labor Day. So by Labor Day, we have to have all the information so that the technical crew can go through all of these submissions and take care of all the potential flaws, all the potential errors, so that the fellows can benefit from a first-class virtual Congress. You deserve no less than that. And so that's why we are working diligently with our presenters, imploring them to abide by the stated deadline, because if we cannot get everything organized in a timely manner, we will not be able to offer those particular critical components of the clinical Congress. So I implore all of our presenters to make sure that they work diligently over the next 4 weeks to submit their presentations in the correct format to the American College of Surgeons. So if we do that, I am confident that the Clinical Congress 2020 will be at least as good, if not even better, than the 2019. And I say this because it will be accessible to such a large body of fellows who normally would not be able to attend the Congress in person. So by making sure we can still offer the material to all of our fellows for virtually no charge, at virtually no charge, it's going to bring a significantly greater benefit for all the members of the American College of Surgeons, nationally and internationally. So, but this can only work if all of our presenters cooperate.
Thank you very much for your insights and reflections, and thanks for all the incredible work you've done. You've produced for us so many outstanding, superlative annual clinical congresses, and I've no doubt that if we do our part to help you put the icing on the cake that you've already got ready to go in the oven, that we will have, different than gumbo or sausage perhaps, we're putting the icing on for you, and we're going to get this cake in and baked, and it's going to be absolutely delicious and the best clinical congress yet. So kudos to you. Now it's up to us to make sure it happens.
Thank you very much. Favorite food metaphor works.
Okay, looking forward to seeing you in person one day. Thanks.
All right.